Yeah, slap lesions are actually very common. The labrum is a tissue that's in the shoulder joint, and it's partly responsible for the stability. So the humerus bone stays in the shoulder socket. So the ligaments stabilize the shoulder, as does the labrum. The word labrum actually means lip, so it's an extra lip of tissue. So the shoulder joint, because it has so much mobility, it'll stay in socket. So when you get a labral tear, basically there's generally a clicking sound and the shoulder joint doesn't feel as stable. And when you try to use the shoulder, like if you're a tennis player or a pitcher, there's no power in it because the shoulder joint is unstable. There's various kinds of lesions of the labrum. They all have the same significance basically, but a slap lesion means the lesion is superior to anterior. And the lesion of a slap lesion occurs where the long head of the biceps muscle actually attaches there. The bottom line is basically, if I was going to educate somebody on a slap lesion, is by definition, if you have a labral tear, any kind of labral tear, it doesn't have to be a slap lesion, is the shoulder joint is unstable. So just injecting something inside the joint just isn't good enough. You have to get comprehensive prolotherapy because whatever caused the slap lesion, I'm telling you, it injured the ligaments in the front of the shoulder, the back of the shoulder, some of your rotator cuff tendons, probably your biceps tendons. So you have to get all those things treated. When somebody gets an MRI, normal MRIs can give you a false negative. In other words, it could be negative even though you have a slap lesion. So if you're going to get an MRI, you have to get an MRI arthrogram. Prolotherapy is a very, very good treatment for slap lesions. I mean, I would really encourage people to use prolotherapy and only get surgery if prolotherapy fails. And I can't even remember the last time I had a patient who didn't respond to prolotherapy for a slap lesion. There are different solutions that we use. So normally we start with the dextrose solution, but sometimes we will use platelet-rich plasma. I know there's a lot of doctors out there doing platelet-rich plasma, including orthopedic surgeons, so I'm very happy about that. But you got to realize you can't just get platelet-rich plasma prolotherapy inside the joint. You have to get platelet-rich plasma prolotherapy inside the joint, but then you also have to treat the front of the shoulder, back of the shoulder. So when I do prolotherapy for a slap lesion in the shoulder, a person might get 30 separate injections. And that way they're insured and I'm insured that we did all the areas that are involved, the tendons, the ligaments, as well as the slap lesion. Typically people will get 4 treatments. As far as rehabilitation after you get prolotherapy for a slap lesion after the first visit, I normally would have them do exercises that limit their shoulder motion so the elbow stays close to the side. So in other words, they can't do lat pull downs, they can't do throwing, they can do any exercise where the elbow is close to the side. And as the shoulder joint stabilizes, then I'll liberalize the exercise program. Some people don't get better from prolotherapy with slap lesions because they don't rehab it properly. In other words, they put the shoulder joint in an abducted and external rotated position, which puts strain on the labrum. So in other words, they're putting the labrum under strain while it's torn, and even though the prolotherapy is repairing it, you're putting too much pressure on it. So it's kind of technical, but with a slap lesion, you got to get prolotherapy inside the joint for the slap lesion, as well as the ligaments and tendons around the joint. And then you've got to be careful as far as an exercise program. But following certain guidelines, you can make a complete recovery with prolotherapy, so that way the person doesn't have long-term problems. Typical surgical operations like removing part of the labrum, that doesn't stabilize the joint, and even the tacking or stapling down that they're doing now. I personally wouldn't want staples or tacks in my shoulder joint, for many, many years, many, many decades. I'm just telling you, to me, there's going to be long-term problems. So it's too complicated. Like, would you want some staple or some tack in your shoulder joint? And you're moving, most people don't realize you move your joint, your shoulder joint or your hip joint. Hip joint also has a labrum. You move it around 1 million times a year. So you're saying to me, if you get staples or tacks in there and it's moving around 1 million times a year, that isn't going to be long-term cause labral issues, down the road. So A much better option is do prolotherapy first, slap lesion and other labral tears.